Well, almost 600,000 staff in public and private schools will be vaccinated before schools close for the second term. Of course, this is a mammoth task, and it's expected to start on Wednesday. Teachers will receive a single dose of the Johnson & Johnson jab over the next 2 weeks. For more on this, I'm joined by the National Professional Teachers Organization of South Africa's Executive Director, Basil Manuel. Thanks for your time, Basil. We appreciate it. I don't want to be accused of being a negative Nelly, so let's start with the optimism, right? You are, of course, excited that teachers, deserving teachers, will be getting these jabs.
Well, yes, we are excited. Shahan, it's been a long road, and NAPTOSA, together with other teacher unions, and of course with the support of the ministry, pulled out all stops from the very beginning when the jabs first became available, and we insisted that teachers should be part of the frontline staff. That has eventually come to fruition, and of course it was made even a little sweeter on Saturday when we heard that the 280,000 additional jabs would come. That now ensures that all education workers will get the jab. So yes, we are happy. We're elated by the news.
Yeah, you know, I actually got people messaging me to find out if even teaching assistants will be getting this jab. Do you know how far and what the scope is when it comes to people within the education sector as it's being labelled?
Shahan, as long as they are on the staff at the school, then they will qualify because their names would have been submitted. So that includes the teachers, first of all. If the teacher assistants are there at the school, yes. And then, of course, we have all the assistant staff, secretarial staff, groundsmen, and so on. And then the ECD centres that are part of the DBE. We know some ECD centres, of course, fall under social development, and that's another department that has to deal with this. So yes, we're covering as many people as we can within the scope of the DBE.
All right, let's get to the critical questions then. We know that our government has been doing pretty dismally in terms of vaccinating people in this country. 2 weeks to vaccinate over 600,000 people in the education sector. Do you think that's going to happen?
Well, if all the paperwork is to be gone by, I've looked at all the plans from all the departments, and remember that the plans have been afoot for a long time. Even when we had the hiccup with the J&J vaccine, the plans didn't stop. Provinces planned. We raised questions about the Northern Cape. We raised questions about Limpopo, where we thought there would be problems, and the Northern Cape particularly because they're so sparsely populated and the distance that people would have to go to is great. And we're satisfied now that at least on paper it's all systems go. Now we've got to see that it actually works. Yes, we are worried. We know that there can be hiccups, but I'm quite certain, Shahan, that a hiccup is not going to derail the whole process. Too much effort from too many people who are running in the same direction has resulted in us being where we are now. So that is what gives me hope. Notwithstanding all the history that we have, and maybe this is the time to turn around the history. Maybe this is the time to say, see, this is how to do it, and who knows, it may start us on another road altogether.
You know, there are some threats from some people saying that teachers won't return to class if they don't get their vaccination on time. How do you feel about that?
That has never been the NAPTOSA view. In fact, I can comfortably say it has never been the view uttered by any of the unions within the LRC. The 5 unions have worked very closely together. It wasn't a prerequisite. It was a nice to have. And yes, we certainly did get it on time. Now, besides the 2.5 weeks left before we close school, then we still have the 2 weeks of the school holiday. So in fact, even if it runs late, a month is a long time. Our president had asked that we ramp up the vaccinations to 300,000 a day. Now, surely, if we are even on the road going there, 580,000 is not such a big ask.
Yeah, so also what happens then with the concern about primary schools operating daily? You know, lots of parents are saying teachers might be vaccinated, but our kids can still contract the virus in class and then come and give it to us or their grandparents. Is that a concern you'll have after this vaccination process?
Shahan, we've been talking to various science experts, the same science experts that we see on television all the time, and they advise the Department of Education, they advise the unions as well. And one of the things that is clear is that primary school children are not as easily infected or as infectious as adults. But that's cold comfort when it comes to fear and fear itself. However, the other thing that we know now is that most of the infections come from home. Infections don't come from schools. There's nobody at school to start an infection unless people bring it in. So we still have to abide by the protocols. Even with the vaccination, you've still got to do everything to keep people safe. And of course, we know that hundreds of thousands of our children don't social distance. They social distance at school, cause the teachers to have great aggravation trying to keep them apart, and as soon as they get to the school gate, it's all forgotten. So yes, there are concerns, but our concerns are not so much with the primary school as it is with the high school. So we are in support of the primary schools going back. We've always been, for a variety of reasons, not only science, but primarily education-based. And as a former principal of a primary school, I can tell you that the current grade 2s can't even do basic reading because they did not have enough time in grade 1. So we don't want a lost generation, and we're going to have to do. However, we've said to the minister, and we're on record as saying, and so too have others, this isn't a blank check. We're going to watch, we're going to see what is happening, and if for some reason something goes wrong, we are going to call in the troops and we are going to say we need to meet so that we can have a review of this. And that undertaking has been accepted from whence it comes, a good place, a place of understanding and support, but not a place that says, yes, we can just roll along and let's forget about the people that we really should be taking care of.
Yeah, that's a very interesting situation. Of course, I hope you do hold the ministry accountable for what's going to happen. I hope to speak to you in a couple of weeks where we talk about all 580,000 doses being, processed in the next couple of weeks. Appreciate your time. That, of course, is NAPTOSA's Executive Director, Basil Manuel.